Today's webinar will cover the circumstances that trigger a special enrollment period and then timing of coverage effective dates for different triggering events. Today's presenter here at the Center on Budget and Policy Priorities is Sarah Lueck, Senior Policy Analyst. And with that, I'll let Sarah take it away.
Thanks, Ina. Thanks to all of you for listening today. Before we go into all the details about a special enrollment period and how they work, we like to spend a little time talking about the basics of this. So that's the first slide here. What is a special enrollment period? This is the time outside of the annual open enrollment period when someone can enroll in marketplace coverage, or if they're already enrolled, switch marketplace coverage. And this SEP, or special enrollment period, is triggered by certain qualifying events, things that happen in the person's life that make them eligible for enrollment or for changing their coverage. As you probably know, open enrollment in most states that are using Health Care.gov runs from November 1 through December 15th of each year for January 1 coverage. But state-based marketplaces can have a longer annual open enrollment period, and most of them did so in this past year. The timing of the SEPs for the marketplace is usually 60 days after the qualifying event, meaning that people have about 60 days. They have 60 days to choose their plan or make their change. Some SEPs are also available before the event happens, which means that they get time ahead of time, the 60 days prior to that event, to choose a plan and hopefully avoid a gap in coverage. For some SEPs, there's different types of effective dates. For many, there are regular coverage effective dates where if you select a plan between the first half of the month, your coverage becomes effective the first day of the month following that month. If, on the other hand, you select a plan in the latter half of a month, then coverage would become effective under regular coverage effective dates on the first day of the second following month following plan selection. And some SEPs have special coverage effective dates. In fact, many of the ones that you might most commonly see have special effective dates that allow the coverage to start more promptly. For some SEPs, there's a requirement that the person that has this event that triggers the SEP must also have had some coverage beforehand. So they usually that works in this way. They have to have at least one day in the 60 days before the event in order to qualify for the SEP. Some exceptions to prior coverage requirements is that if a person could have been living outside the US, in a foreign country or a US territory within the past 60 days, or if they are a member of a federally recognized Native American tribe or is an Alaska Native, they would not be subject to that requirement. So in June 2017, the FFM placed certain restrictions on plan selection for people who are already enrolled in marketplace coverage. When they select an SEP, in most cases, enrollees can only use it to change plans within the same metal level as their current plans. There's some exceptions to that as well. So if you experience a change in eligibility for cost sharing reductions, you're not bound to remain in your plan level. You do have the ability to move into a silver plan if you don't have one yet. And that's important because cost sharing reductions are only available if you enroll in a silver plan. Another exception is marriage or birth and adoption. If an enrollee gains a dependent or gets married, they can only use the SEP to add a new dependent or spouse to their current plan, or the new dependent or spouse can get into their own plan, their own separate plan, and have an open choice of which plan that is. And then there are some SEPs that you see listed here that are exempt from the restrictions on plan selection. In addition, if you're in a state with a state-based marketplace, there is additional time to implement this change, and many have not implemented this change. So this is not something that you're going to see in those cases. Events that trigger a special enrollment period. Let's look at some broad categories first of the kinds of situations that people might have in their lives that would trigger an SEP. One major category, and probably the most common one that you see in the real world, is loss of other coverage. So that examples of that might be losing an employer plan or becoming ineligible for Medicaid, or if you're in a plan that doesn't run on a normal calendar year, if it expires in the middle of the year, that would be an example of a loss of coverage. Some other categories are if your household size changes, so marriage, birth of a baby, changes to your family, if you move, if you change where you live. If your eligibility changes for financial help, there's various SEPs. If you meet certain standards and qualifications, you can access SEP that way. And then there's other less common circumstances like plan errors or misconduct by the marketplace or a broker or an insurer that can let you change your plan. Another set of other circumstances that we're going to mention that you should refer, I think, to your chart to really delve into the details of these. If these are situations that you're finding, there is the reference chart that you see linked at the bottom of the slide that sort of lays it all out for you, so you don't have to keep this all in your memory, and you can use that as a reference tool when you come across a case in real life that you're trying to understand how it might fit. One recent addition to our chart is what you see under number 6, which is a new SEP for people who become eligible for individual market HRAs or QSARAs. These are recently added types of accounts for employers to contribute to their workers' purchase of an individual market coverage, including coverage on the marketplace. So if someone gets access to one of those accounts from their job, that is now an SEP that they can, use that funding from an employer to go to the marketplace or to the individual market outside the marketplace and access a plan with that funding using an SEP. So loss of qualifying coverage, as I said, this is a very common one. Happens to people all the time. Some of the important things to know are that loss of an employer plan isn't just that, it can be a variety of situations that are included in that. So if a person loses their job and they lost their plan because of that, if they quit their job, if they're fired, if they have a change in their job so that like their work hours are reduced and they're no longer able to have their employer plan, they don't qualify for it anymore. Those are all examples of cases of losing an employer plan. Similarly, losing eligibility for Medicaid or CHIP would be a loss of other coverage. If your plan that you have had is canceled and it meets the standards as minimum essential coverage, it would also trigger an SEP, as would things like loss of eligibility for student health plan. It's also important to know that loss of pregnancy-related Medicaid coverage is included on this list, as well as medically needy coverage, and similarly expiration of a non-calendar year plan, even if a plan isn't expiring, even if it can be renewed. So lots of situations where people might experience changes in their lives that trigger an SEP because they've lost other coverage. So here's an example of how this works in practice. This is Joe and Danielle. They are enrolled in health insurance that Danielle gets through her job. She quits her job in May and her health benefits are scheduled to end on May 31st. She has an option to access COBRA when she leaves her job, but she would have to pay the full cost of the premium and it costs too much for her. So instead, Joe and Danielle decide to enroll in the marketplace. They are eligible for an SEP, and they have 60 days both before Danielle's coverage ends and after Danielle's coverage ends to pick a new plan in the marketplace. And the good news is if they do it ahead of time in the 60 days prior to her coverage actually being done, then they've done it in enough time for the coverage to start without a gap. So if they select their plan in this example on May 16th, before her plan's even ended, the coverage continues through May on her employer plan, and then on June 1, her coverage begins the first day of the month following the end of her plan. So that was good news for them. It worked pretty smoothly. But what if they select a plan after they lose coverage from Danielle's job? In that situation, let's say Joe and Danielle don't pick a plan until the end of July. So the coverage has already run out. Because they waited until they lost coverage, they will have this gap in coverage. They still have an SEP because they have 60 days after the employer coverage ended, but they do have this gap, this period of time where they don't have any insurance. So in this example, they picked July 17th, and then the coverage begins August 1. It's good that they made it in the window of the SEP, but it's good to be aware that sometimes if you can do it ahead of time, it saves you the headache of having a gap in your health insurance. Household size changes like getting married or having a baby or adopting a child or having a child placed in your home through foster care or court order. Those are all cases when an SEP can be triggered. In the case of marriage, there is a requirement for prior coverage. So it's only triggered if at least one spouse had minimum essential coverage in the 60 days prior to the marriage, or otherwise qualifies for an exception from the prior coverage requirement. And let's look at that, how that looks in practice. This is Jay and Kim. They get married on July 12th. Kim was insured through her job and Jay was uninsured. And in this example, Kim drops her coverage on May 31st. So it's before the marriage. She just decides that she's not going to keep this coverage anymore. Then they get married. And in this example, it's only been 42 days from the time that Kim dropped her coverage and she and Jay get married. So lucky them, they get to have an SEP. They pick a new plan on July 17th and their coverage begins August 1. And because Kim had coverage before in the right window of time, the couple can both get access to an SEP, even though Jay was uninsured before. If in a different example, Kim drops her coverage early in the year, so let's say April 30th, then it will have been 73 days, not within a 60-day window, that she's been uninsured. Neither of them have had coverage during the 60-day window. So when they get married, there is no SEP triggered for the marketplace. So that is not going to work for them. Some other examples of SEP triggering events would be a permanent move. And this is a bunch of different situations that fit into this. This could be moving within the same city, county, or state, as long as different plans are available to the person. It could be moving to a different state. Certainly, you can't stay with the same marketplace if you move to another state. A child or other dependent moving back to a parent's home. A student when they move from where they attend school to their home with their family, moving for seasonal employment, but maintaining a home in another location, like a seasonal farm worker might experience, or moving to or from a shelter or other transitional housing. Those are all some examples. Another example is moving to the US after living outside the country or in a US territory. For many of those move situations where the person isn't coming from out of the country and is not an American Indian or Alaska Native, they will have had to have that requirement of prior coverage. They will need to have had at least 1 day of minimum essential coverage in the 60 days prior to the move. So in an example, again, we have Daniel, Marie, and Amina. They live in Illinois. They all had coverage through Daniel's job, but that coverage was too expensive, and they decided to drop it at the end of May. And then Marie got a new job in Ohio, and the family moves in early July. In this situation, this family is eligible for the SEP triggered by the permanent move because they did have coverage in the last 60 days. So if they move to Ohio and they pick a new plan on July 17th, they can have their coverage begin on September 1. There are a variety of situations where people's may experience changes in eligibility for financial help, and these are important to know as well because they sometimes can trigger an SEP if the person meets the right requirements. So in this example, the person has moved out of the Medicaid coverage gap. That triggers an SEP if the person was previously ineligible for Medicaid because the state that they lived in had decided not to expand Medicaid, and their income then increases to a level above the poverty line, and that makes them eligible for a PTC in the marketplace, and they get to access an SEP in order to access that PTC. The person does not need to have had prior contact with the marketplace to be eligible for this SEP, and it applies across states. So if a person moves to a state that expanded Medicaid and has a change in income making them eligible for PTC, they could get this SEP because they had previously lived in a place that didn't expand Medicaid. Another example when somebody might experience a change in eligibility for financial help is when their current employer plan is no longer considered qualifying employer coverage. So this would be if somebody becomes newly eligible for PTC due to a change in the plan such that it's no longer adequate coverage or affordable coverage under the standards set by the ACA. If that happens, then the person becomes newly eligible for a premium tax credit and they can use this SEP. In order to do so, they're going to have to drop their employer plan and then enroll in the marketplace coverage. Some other examples here, in changing eligibility for financial help, people can become newly eligible for marketplace coverage when they have newly gained eligible immigration status. So if they didn't have eligible immigration status before, at the time when they could have enrolled in marketplace coverage, then they newly gain it, then there is an SEP available for them to be able to access a marketplace plan and subsidies if they're eligible. If a person is released from incarceration, whether that's detention, jail, or prison, and they then become newly eligible for marketplace coverage, because people aren't eligible for marketplace coverage when they're incarcerated. So that is also going to trigger an SEP in the marketplace. There are a variety of special situations under the SEPs for American Indians and Alaska Natives. So if somebody becomes a member of a federally recognized tribe or a Alaska Native Claims Settlement Act Corporation shareholder, that will trigger an SEP in the marketplace. And also if the person becomes a dependent of someone who is an Alaska Native or an American Indian and is enrolling or has been enrolled in the same plan as that person, that will trigger an SEP. There's a variety of changes related to premium tax credits and cost sharing reductions that are important to be aware of, because people do have these experiences where their income or household size changes and they may be able to get an SEP to change or enroll in coverage. So if someone is newly eligible or ineligible for tax credit, so during the year they experience an income increase or an income decrease or a change in their household size that changes their eligibility, they can access an SEP to make changes in their coverage. But this is only triggered for people who are currently enrolled in a qualified health plan in the marketplace. Similarly, if somebody has experienced such a change, such as their CSR eligibility shifts, so they are moving between different income levels, different CSR eligibility levels, or they're gaining eligibility for CSRs, there is an SEP available to them if they are currently enrolled in a qualified health plan in the marketplace. And then there's a newer SEP for people who are newly eligible for premium tax credits after their income decreases. So there's a couple of conditions that they have to meet in order to be able to access an SEP for this. They have to experience the decrease in household income and be determined newly eligible for a PTC. And there is a prior coverage requirement, so the person has to have had coverage for 1 day within the past 60 days, but it doesn't have to be a QHP. They could be having other coverage that is as long as they haven't been uninsured, they've at least had coverage for 1 day under minimum essential coverage in the last 60 days. They can become newly eligible for PTC and access coverage in the exchange. So let's look at an example of one of these changes in income. This is Miguel and Jane, and they're married. They have one daughter, the little daughter Isabella. Their income is over 400% of poverty, so they are not qualified for subsidies in the marketplace. And the family, knowing this, decides to enroll in a bronze plan for the year at full cost. But then in June, Miguel has his hours reduced at work and the family's income decreases such that they become eligible for premium tax credits and cost sharing reductions. So at that point, the family decides it's better for them to change to a silver plan. And the good news is there is an SEP for them. They have been enrolled in a QHP and they meet the criteria. So they change to a silver plan. They're able to get the lower deductibles that they get with their new cost sharing reductions. Some other types of situations that are probably less common, but that do trigger an SEP in the marketplace are if people experience errors, misconduct, or inaction, or improper actions by the marketplace, HHS, or a non-marketplace entity that is helping them with their enrollment. So that could be brokers, assisters, web brokers, and those kinds of errors do have to be accessed through the marketplace or shown to the marketplace to be true errors that weren't an SEP. So it's a little less common. It's not something that people can access just through the website. They're going to have to explain their circumstances to the Health Care.gov folks. Similarly, plan or benefit display errors that are on a website at the time of the plan selection, that can, if there's an error in that, that can warrant an SEP. Similarly, if a health plan, health insurer violates the contract with the enrollee, that can cause an SEP if the person's been enrolled in that plan. Other circumstances include being determined ineligible for Medicaid or CHIP. So if a person applies for Medicaid or CHIP during open enrollment or during a special enrollment period, and their state's Medicaid agency determines the individual dependent or their dependent ineligible, but it's after the marketplace enrollment period has ended, then that person can access an SEP. It was basically, you know, no fault of theirs that there was this time that passed, and their time frame for the SEP or open enrollment expired, so they do get a chance to enroll after that time. And this applies regardless of whether the person applied through the marketplace for the program or if they applied through the state Medicaid agency, as long as they took that action during an open enrollment period. Another kind of related issue is if somebody's confronting a data matching issue. Those are when there's inconsistencies perhaps in somebody's income or their citizenship or immigration status information, what they're reporting on their application versus what the exchange thinks is true about them. And they have to provide additional information to clear up that inconsistency. If the DMI is resolved after the person's coverage has been terminated, after that initial inconsistency period, then there is an SEP available to some of those folks if they had income under 100% and did not enroll in coverage while they were waiting for the marketplace to verify that they were eligible for PTC based on immigration status. So here's an example of how a DMI kind of issue could play out. This is Roberto and Monica. They are married and they have 2 kids, Miguel and Elena. When they apply for coverage, Monica, who's a derived citizen, gets a data matching issue and is asked to send in some documentation to prove her citizenship. She sends documentation, but the marketplace says it's not the right thing. It's insufficient to show that to resolve the DMI, and so her coverage gets terminated at the end of March. So then in April, she tries again. She sends in more documents and her DMI is resolved on May 14th. And because her coverage was terminated, but she then kind of sends in the right documents, she's able to get an SEP. She selects, in this case, she selects a plan on June 16th, and her coverage can actually begin retroactively to account for that time that she was working on getting the documentation provided to the marketplace. Some other circumstances that people might confront are when somebody experiences domestic violence or spousal abandonment and they want to enroll in a health plan separate from their abuser. As long as they have had health coverage, they can access an SEP to get a new plan on their own, as well as for their dependents if the dependents join them on their new plan. For exceptional circumstances, these are really usually very rare, at least in the view of the FFM. It's really things like if a natural disaster happened during open enrollment that prevented people from signing up, or if somebody has been unexpectedly hospitalized in such a way that they've not been able to enroll in the regular annual period. Those sorts of situations can warrant an exceptional circumstances SEP from the marketplace. Sometimes it's useful because there's so many triggering events to think about what doesn't trigger an SEP in Health Care.gov, just to kind of know if a person has this situation, it's probably not going to help them get an SEP. So if somebody voluntarily drops their other coverage, if they just say, I can't afford this anymore, I'm not going to have it anymore, that on its own does not trigger an SEP. Similarly, if somebody loses eligibility for a plan, but they weren't really enrolled in it, that does not trigger an SEP. So if they lose their job, but their employer's health plan, their employer had a health plan, but they weren't actually in the health plan, then losing the job does not trigger an SEP. All on its own, being determined newly eligible for a premium tax credit does not generally qualify you to enroll in the marketplace with an SEP when the person was previously uninsured. As we talked about, there are some cases where being determined newly eligible for PTC can help you get an SEP, but there's other conditions that you have to meet. being terminated from other coverage if somebody hasn't paid their premiums or if they've committed fraud, which is a rare thing, but I guess it happens. If somebody's terminated for not paying premiums, that's a little more common. That does not trigger an SEP. Divorce or death on its own does not trigger an SEP in the FFM if the person doesn't also lose coverage as a result of those events. Although state-based marketplaces do have the option of implementing an SEP for people in those situations. And then also in the FFM, becoming pregnant does not trigger an SEP. There are several states that do have an SEP. When someone becomes pregnant, they are allowed to enroll in marketplace coverage, but that is not the case in Health Care.gov. So let's look at an example where somebody does not get an SEP. So in this situation, Carla has a job that and her employer offers health coverage, but she decides not to enroll in it. Then she finds out in May that her work hours are being reduced and she's no longer eligible for the employer coverage. Her income is dropping because of her work hours being reduced, and she no longer has the offer of coverage. So she hopes that she could be eligible for an SEP. She would be able to get subsidies in exchange. So if she wants to be able to get a marketplace plan. Unfortunately, this situation does not trigger an SEP. Carla is going to have to wait until the next open enrollment period to enroll in coverage in the FFM. Because obviously if she had been enrolled in her employer coverage and then her income dropped and she applied at the marketplace, she'd be able to get an SEP, but this isn't the situation here. Some restrictions on plan choice. As I mentioned, there are these relatively new restrictions. And this isn't something you're generally going to have to think about. These are things, these kind of restrictions on plan choices, what people are able to choose, should be incorporated into the plan selection process on the website. So if the person is using the website, this will be clear to them that there's some plans that are available and there's some plans that are not available. But in general, for most SEPs, people who are enrolled in marketplace coverage, that's who we're calling enrollees, can only use an SEP to change plans within the same meta level as the plan they currently have, with some exceptions. And also, if somebody has a change in eligibility for cost sharing reductions, that's an important SEP to know about. The person can change levels, right? The enrollee can use the SEP to change to a silver plan if they don't already have one. Or they could change within the same meta level as their current plan. In addition, if an enrollee gets married, gains a dependent by getting married, or having a baby or adopting a child, they can only use the SEP to add that new dependent or that spouse to their current plan that they already have. Or the dependent can enroll on their own in whatever plan they want, the dependent or the spouse. In general. One exception would be if the plan that the enrollee already has in the marketplace doesn't cover the dependents or the spouse. The enrollee then in that case can actually change plans in order to enroll with the dependent in a new plan in the same meta level. And if that isn't available, they get to change meta levels. But again, it sounds more complicated than it is. It's kind of a complicated set of plan restrictions to think about, but the computer will think about it for you if you're using the website. There are some SEPs that are exempt from these restrictions on plan choice. So for current marketplace enrollees, one is that American Indians and Alaska Natives are exempt. The situations that we talked about where there are errors by the exchange or somebody helping you enroll in coverage, that's exempt from restrictions on plan selection, exceptional circumstances, and then the domestic abuse, spousal abandonment SEPs. So what is the process for reporting? Oh, let's pause for a second and we'll take some questions.
Great, thanks, Sarah. We do have a couple questions come in. So we'll start with this one. If one member of a married couple had coverage and the other was uninsured when they got married, can they both qualify for an SEP to get coverage?
Yes. If one person's uninsured, as long as one of the couple has had coverage in the last 60 days, both of the members of that couple can have an SEP.
Does the requirement of prior coverage apply nationwide, or can states with state-based marketplaces waive the requirement?
So it is in federal rules, but there is some leeway for states that run their own marketplaces. And my sense is that many of them have not implemented these plan choice restrictions, so that it will be quite different for for those of you that are working in states with an SPM.
Great. How does a consumer prove that there has been an error on the part of the marketplace or an assister or a broker?
Yeah, this is, as I said, not that common of a situation, I don't think. I think it would be the kind of situation where the person would need to have a lot of proof that the thing had happened, and would have to be able to provide some information and details, and um, that's kind of proving the error to the marketplace. There's no specific rules for what proof has to be provided, but it is at the marketplace's discretion whether this SEP is granted. So I think having as much proof as possible is probably a good idea.
If someone has an insurance plan that is not minimum essential coverage, can they terminate their non-qualifying insurance plan and still get an SEP?
So no, if they are, for example, in a short-term plan that is not minimum essential coverage, and they can't just sort of leave it, or even if that plan ends, because short-term plans do end after some period of time, depending upon state rules, that doesn't trigger an SEP in the marketplace because the coverage that the person had wasn't meeting the standards of minimum essential coverage. In general, if a person has minimum essential coverage and they terminate it, that also is not going to trigger an SEP. There's other situations that do trigger an SEP, where, like when the person has employer coverage, and we talked about the example where work hours are reduced and the contribution changes, then they get to go into the marketplace and they have to terminate their employer coverage. But just terminating coverage that you already have, that's minimum essential coverage, doesn't trigger an SEP.
Great. A couple more questions here. Can a consumer who gets a denial letter from Medicaid outside of open enrollment qualify for an SEP?
Generally, the SEP that's available to folks that have applied for Medicaid and they sort of no. So here's the thing. You can apply for Medicaid at any time. So just applying for Medicaid outside open enrollment and getting a denial letter doesn't trigger an SEP. The SEP that we talked about that does exist is the one where if you've applied for Medicaid during open enrollment, and it's just taken time for you to get your denial letter, that would be a situation where someone could get an SEP. But you couldn't just sort of go and apply for Medicaid and be found ineligible at any time during the year and use that denial letter to trigger an SEP in the marketplace.
Is someone eligible for an SEP if they've been diagnosed with a major medical condition such as cancer?
Not generally. There isn't like an SEP for that purpose, but there is the exceptional circumstances SEP that I mentioned. So there may be cases where if someone is really incapacitated during the time of open enrollment, or has some sort of situation where they were unable to enroll in coverage during open enrollment, that would be a situation that could trigger an SEP. Somebody who has very serious illnesses might also be experiencing other events that would trigger an SEP, maybe not working anymore, maybe other kinds of things that are happening that would potentially trigger an SEP. So it's worth looking into that. But the fact of having an illness and getting sick in and of itself does not trigger an SEP.
And one last question, is an SEP triggered for a pregnant woman who was uninsured after she has her baby?
When the woman has her baby, if she was uninsured beforehand, yes, there is an SEP. The SEP for birth would apply, and there is no restriction for the woman to have had prior coverage. And the birth triggers the SEP so that the baby and the mom can enroll. I think we do have some question. We want to check in on what happens when the baby is perhaps not eligible for a QHP. If the baby is going to end up in CHIP or some other program and the mom is eligible for a QHP, we have a question about whether the website at Health Care.gov will correctly determine that she's eligible for an SEP, but the rules say that she is. So we will check on that and get back to you.
Thank you so much, Sarah.
Sure. So we'll pick up here on how the process actually works and a little bit about what it looks like when you're trying to get an SEP at the marketplace on healthcare.gov. So in general, people who have marketplace coverage do need to report changes if they have any during the year on their original application. Not every change that you would report to the marketplace would trigger an SEP. Some might change the amount of the premium tax credit a person is eligible to receive, for example, and not necessarily give them ability to change their plan. Some of the changes that people should be reporting are changes to their income, changes to their household, if they move to a new permanent address, especially if they're moving out of state, because their coverage isn't going to go with them. They're going to need to start a new application in the new state. And then changes in status, such as tax filing status or citizenship or immigration status, should all be reported to the marketplace. If you're already enrolled in a marketplace plan, you can go to the marketplace application and click the button to report a life change, and then go through the application and edit that information that has changed. And if it triggers a marketplace plan, that will be triggered for you. If you're not enrolled in a marketplace plan, the person can go to the marketplace and then start a new application, and same thing happens. Once an application is completed, the eligibility determination notice will arrive. It will inform the consumer of whether they can access an SEP, and then the consumer can switch plans or enroll in the new plan during the SEP. On Health Care.gov, people who are newly enrolling in marketplace coverage through certain SEPs are required to submit documentation to prove eligibility before they're actually enrolled in and using the marketplace coverage. This is called an SEP verification issue. And these are generated for new applicants who attest to one of the events that triggers an SEP. It's most of the events that people are experiencing. The person will have 30 days after selecting their plan to provide documents that show they're eligible for the SEP, and we'll talk a little bit more about those documents in a minute. Once their eligibility for the SEP is verified, their enrollment file will be sent to the insurer, and the applicant will need to pay the premium and effectuate their enrollment. So it's a multi-step process that people have to get through. State-based marketplaces that do not use healthcare.gov are not required to conduct pre-enrollment verification of SEP eligibility, and so some of them may not do this, and then some of them may do it in a different way or do it for different circumstances. Which SEPs will require an SVI? So definitely some of these big ones that we know of: loss of other coverage, permanent move, marriage, adoption for or placement in foster care, placement for adoption or child support or other court order, and a Medicaid or CHIP denial will all require some documents to be filed if the person's newly enrolling using that SEP. Right now, pre-enrollment verification does not apply to the birth of the baby. So here's the process for how it would work if in an SEI process, the person would submit their application. This is a new enrollee. They're going to the marketplace and putting in their application. They're granted their SEP, and that generates an SVI. They pick a plan, and their enrollment is pended, and then the clock begins on the SVI. They have 30 days to submit the documents that the marketplace needs to resolve the SVI. The person submits the documentation of the event that triggered the SEP, the marketplace reviews it, and in a situation where the documents are good, the SEP is verified, and the issue is resolved, the marketplace sends the enrollment file to an insurer and notifies the applicant, and then the person is going to need to pay their premiums to technically actually effectuate the enrollment in the plan. In another scenario where maybe somebody requests, where the marketplace requests additional documents, whatever the person sent was not enough, then the marketplace cannot confirm that person's eligibility for an SEP, and their SVI expires and their plan selection is canceled. In a different kind of situation where the person doesn't select a plan, it works slightly differently. The person submits the application, they get the SVI, they submit the documents. In a case where their EP is verified and the SVI is resolved, the person goes ahead and picks the plan and completes their enrollment because they hadn't already picked it. Or if the marketplace needs additional documents and the marketplace finds it cannot confirm SEP eligibility, then the SEP window eventually will end after 60 days. Once eligibility for an SEP is verified, coverage generally begins on the original coverage effective date. the applicant will pay the first month's premium to effectuate enrollment once the SVI is resolved. If the SVI is resolved after the original coverage effective date, coverage can begin retroactively. The insurer is responsible for paying any claims on covered services in the retroactive period. And if the SVI is resolved more than 2 months from the original coverage effective date, the applicant can choose to have their coverage begin 1 month later than the original effective date instead. So here's an example of loss of other coverage. Ricky and Eva are and how it works with the SVI. Ricky and Eva are notified that they're losing eligibility for Medicaid coverage on May 31st. They are eligible for an SEP, but enrollment is pended until they prove eligibility for an SEP. They need to submit documents proving the date that their Medicaid coverage is ending, who is losing that coverage, and what type of coverage they had. In this example, they select a plan on May 23rd and their enrollment is pended, and then the 30-day SVI clock starts, and they have that 30-day period to provide the information that they need to provide to the marketplace. On June 12th, they receive a warning notice. On June 18th, they send in their documents. On June 26th, their SEP is verified because the documents they sent were good. And their coverage is effective June 1, so a bit earlier. And the family pays their June premium, and they are technically covered for all of June if they've had any medical claims during that time. There's a bunch of different verification kind of processes going on and a bunch of acronyms that are associated with them. So it's good to kind of lay out what each of those are and have them all on this one chart, we thought. So that you have identity proofing, that's ID proofing, the process that someone needs to fulfill in order to get access to an online account, a full access to an online account. There's the data matching issues that we talked about a little bit, DMIs, where there's an inconsistency between the information that the person puts on their application and the information that the exchange has about that person, and they have to provide some additional information within 90 or 95 days after applying for coverage. And then you have the separate SEP verification issue that we just discussed. With each of these, there are different sort of timelines, there's different impacts if they're not resolved, and this chart is just a good reference to help you remember each of those and how they work. The slides, the next few slides are going to show you different examples of the specific documents that Health Care.gov says are what you need to prove an SEP, verify your SEP, so resolve an SVI. Not all of these documents, obviously, but these are the kinds of documents that have the information that the marketplace is going to be looking for. So these are the kinds of things that clients can look for, collect, or bring to help resolve these issues. So lots of letters on official letterhead from an employer, from an insurance company, those can help show where the person had coverage before, who's losing the coverage, and when the coverage is going to be ending. I'm not going to go through all these. These are just, references from Healthcare.gov about what kinds of documents they will be interested in and looking for. And you should definitely consult this if you run into this situation. And I think that's where we're going to stop. I'm going to go through a couple of the resources that we have. This is the link and a visual of the chart that I mentioned. That I think it's a little bit long, but it's really useful if you're dealing with a person and you're trying to figure out if they might meet the triggering event for the SEP. And if they do, it will tell you about when their coverage becomes effective, whether there's a prior coverage requirement. All of those little details are sort of in one place. So you can hopefully find a situation that fits the person that you're working with. In addition, Community Catalyst has done some great SEP outreach materials with graphics and flyers and slides that can also be useful for explaining these things. And then here's a resource list with a bunch of different links that can be helpful for you. Different rules that cite all these different SEP triggers. If you really want to dig into the details and go beyond the basics, this is all here. And then this last bullet here, the employer coverage and premium tax credit eligibility tool, would be great to consult if you're looking for more information about health reimbursement arrangements. you have more questions?
We did have one more question. Can you talk a little bit more about how the new SCP for ICRAs and QSARAs works?
Yeah, so that's the individual market HRAs. HRA stands for Health Reimbursement Arrangement, or QSARAs, which are qualified small employer HRAs offered by small businesses. I mentioned them at the very beginning. Those are special accounts that are relatively new that employers, some of them for small employers only, some of them are for employers of any size, to contribute toward the premium of a person's individual market health plan, including a marketplace health plan. So people can take the funds in those accounts and use them to buy a plan. There is an SEP for that, but to understand a little bit about what those are, if you're starting to see them and you want to have more information about it, this final link here on this page is a good reference because it has a lot more detail.
Great, thank you so much, Sarah. As a reminder, we'll be distributing the materials from today's session via email, and we'll post everything to the Beyond the Basics website at healthreformbeyondthebasics.org. Our next webinar will cover the marketplace appeals process and is scheduled for Tuesday, February 25th at 2 p.m. Eastern, 11 a.m. Pacific. You can register for the upcoming webinar on the Beyond the Basics website under upcoming webinars. You can also find additional resources on the website, including reference charts, guides, and frequently asked questions. If you have questions or need assistance, please email our Beyond the Basics contact email at beyondthebasics@cbpp.org. And with that, we will bring this webinar to a close. Thank you again for joining us today.